Connect MKE is sponsored by U.S. Bank. May is Mental Health Awareness Month, and it couldn't come at a better time. Millions of Americans are struggling with mental health issues. Here in Wisconsin, it's young people who may be facing the greatest challenges. According to a recent report, 1 in 10 Wisconsin teens say they attempted suicide in 2021. Half of all Wisconsin youth have been diagnosed with depression, anxiety, or behavioral problems. What is at the root of this growing number of people in our country and in our state dealing with mental health issues? And how can we actively improve and protect our mental health? Joining us with some ideas and help is Dr. Kristin Miles, an inpatient psychologist with Rogers Behavioral Health. Thank you so much for being with us again, Dr. Miles.
Thank you for having me.
These statistics, especially about our teens, are really alarming. What are some of the reasons you're seeing for this increase in mental illness in our young people?
It's pretty varied, but I think one of the biggest things is feeling a disconnection from everybody around them. I think that we strive as people to be connected and to feel like we belong pretty regularly. At the same time, I feel like the pressures are just so significant lately to belonging, to fitting in, to being the person that you believe others expect you to be. And that pressure can get really difficult at times. When individuals start to feel like they are trapped and they have no way out, oftentimes suicide is the direction they tend to head. And at other times, they feel such great pain that they don't know how to describe it. And it comes out in a statement of, I wish I were dead.
You mentioned that this feeling of wondering if you're the person that people think you should be. Can we attribute that to teens and their really prolific use of social media? You know, you go on TikTok, you look at Instagram, everybody's perfect, their lives are perfect. Are teens perhaps less equipped than adults to kind of filter what might be real and what just might be the theater of social media?
Absolutely. Social media has brought us together in so many ways, but it also has disconnected us in so many more ways. So we tend to present our best selves on social media to get those likes, to get the interest, to get the comments, to get all the positive interactions. We don't very often present the struggles and the challenges of real life. And what people have found is that when they do that, they still also often get support. Now, I do want to be careful and say that you shouldn't just put everything out there at all times and talk with the right people about the things you're struggling with. But at the same time, remember that what you're seeing is not the whole picture. And you tend to see people who are only presenting the absolute positives. And sometimes those aren't even totally accurate. So I would advise people to carefully think about what they're seeing, respond to it the way that you feel comfortable responding to it, but remember that's not the whole story.
That feeling of being disconnected, is that something that has its roots in COVID-19 and the way we all were disconnected from each other and away from each other?
I think that certainly plays a significant role in this. I don't know that that's the full answer, but we did remove ourselves from each other because we had to, and we utilized technology to try and connect, which is fantastic that we found ways to still connect with each other over that time as best as we could. But we need to come back to a lot more of that in-person connection with each other, learning how to talk to each other in person and not behind a screen where you can type out something and then separate from it. Or to put something out there, hoping somebody might respond to it and connect with you, but not actually knowing if they will or how they might respond and connect to you. I do think that humans as a whole, going back in history, were created to be connected to each other. The reason we survived some of the challenges and barriers over so many years is because we connected together, we worked together, we used each other's strength to help each other's weaknesses. And we aren't doing a great job of that right now because of this disconnection.
What can we do as adults, particularly when it comes to helping young people feel that connection?
sit down and listen to the kids, talk to them, have some questions that are open-ended yet somewhat specific. So instead of how was your day, it might be, tell me the best thing that happened to you today. Tell me something that confused you today. Tell me something that was a challenge for you today and how you got through it, or if you got through it. And really listening to them. Take your phone and set it aside. Actually look at them and pay attention to what they're having to say, to model for them how to be able to do that, but also give them that sense of feeling connected to one another.
And teens can really do that for each other. Oftentimes, teenagers will turn to each other for help and support before they turn to the adults in their lives.
Very often, the teens feel that the only other person who understands them is another teen. And in some cases, that could be somewhat accurate based on their life experience. But I do think that we as adults need to listen and not judge too quickly when we are talking to the teens, because their experience really is valid and it is different from ours growing up. And so we can't always make that comparison or give the solutions that necessarily worked for us, but really listen to them so that they feel comfortable and supported to coming to talk to the adult about, especially some of these really heavy topics like suicide, where an adult does need to be there to support them.
One of the things the study found is that over half of the Wisconsin kids who have talked about having mental illness or behavioral problems have noted that it's been hard for them to find help and support and mental health services. Are there some solutions that we need to explore?
So I know that a lot of programs like Rogers are looking at ways to expand treatment across the age lifespan, honestly, to make sure that we can address these needs within the community. And we need to have people who are willing to do that type of work. So encouraging people to go to school and get, especially individuals who want to work with children, to learn how to support children in particular. That's an area that I do feel we are lacking with mental health. There just are not enough people out there who are working with the children and understanding how to help them through some of these mental health experiences. So yes, I do think there's a lot of work yet to be done to be able to help all of our age ranges of people who need assistance.
Dr. Miles, we really appreciate you being here with us today. This is a tough topic to talk about, but if we don't talk about it, we're not going to be able to identify the issue and figure out ways to help our kids who are struggling. If you or someone you know is experiencing suicidal thoughts, call or text the National Suicide Prevention Lifeline at 988 or text Hope Line to the National Crisis Text Line at 741-741. Stay with us. We're back right after this break.